Hi guys, and welcome back to another video. Now in today's vlog, I'm going to be showing you how medical students here in Ukraine carry out their clinical practice. Right now we're in a new department, family medicine, and our doctor is just showing us around the hospital. Let's go.
Where our nurse is working right now. He should take blood collection and also prepare everything for intravenous and intramuscle injection.
So guys, various rooms are for various functions. In this room, this is where blood is extracted, and this is where injections are also given intravenously or intramuscularly.
For checking blood test.
Now this is a blood examination room where the extracted blood is tested and the final result is gotten from.
And we have the conclusion of the conclusion result of the general blood test, but in sometimes it's not enough. That's why we have microscope, and if we see some change on this, the doctor will also can check again the blood test and compare the results. Depending on the results, we can suspect some kind of disease. Yes, we have the normals and we have the results of our patient. This is just Pentra. We're checking blood for biochemical test. Everything for physiotherapy, because doctors for physiotherapy works here. We know everything about this equipment, about indications. So if we want to recommend our patient get some consultation, we recommend to come here and he will decide maybe some kind of procedure he may do. Here we have the training center for different practical skills.
Right now we are going to be carrying out some practicals like ECG, CPR, ultrasound examination, and looking at specimens in the microscope right here in the practical room. Now of course we're in our final year, so we've done all this before over the years, but every time you get into a new department that requires you to know this, then you definitely have to do it again.
Divide the sternum into 3 parts and put your the area of tenor and hypotenor in the middle and lower part of the sternum. Yes, when we divide it into 3 parts.
Right now I'm carrying out CPR with my colleagues. Now this is a special mannequin because it is connected to a computer, right? So when you're doing it correctly, the computer will show you that you're doing it correctly, and when you're not doing it correctly, the computer will show you that you're not doing it correctly. When you don't do it correctly or when you crush a rib, it will show red on the computer, and if you do it wrongly for a couple of times, the mannequin will tell you that he is dead, meaning that you have killed the patient. But the more you practice, the more you get the hang of it.
Several transducers. Some of them we will use to check vessels and the oil gland. This one, and the second one for abdomen. We also use special gel.
This is an ultrasound which uses sound waves to create pictures of the organs.
Hello. It's cold, right?
Right now we are going to be carrying out a thyroid examination and an abdominal examination. Now when using an ultrasound to examine your thyroid gland, it will show you any nodules or any abnormalities like goiter, okay? As you can see, my teacher is showing them my thyroid gland on the screen and asking them to check for any abnormalities, and thank God there wasn't any. Now, of course, you have to carry out more tests, for example, a blood test for more confirmation, just in case you see an abnormality on the ultrasound. Don't mind me, I was trying to look at the screen. After I was done being the patient for my classmate, another classmate of mine became the patient so that I could also carry out the examination on her. And this is a closer look of how it's done. And now to the abdominal examination. Now guys, there are various kinds of ultrasounds, okay? Some ultrasounds will show you superficial tissues, while some ultrasounds will show you deep tissues. Now the ultrasound we are using can show you deep tissues. And after, we moved on to ECG. Right now we are placing the electrodes on my classmate's chest and limbs. Now this is how it looked when we were done placing them. Did you hear that sound? I'm sure you did. It's checking the electrical activity of his heart. And now it's bringing out his ECG results.
God forbid, I reject it for you. I don't care. I reject it for you.
Now, of course, we also looked at some specimens with a microscope. Now, guys, this is not all that we do when it comes to clinical practice, okay? We actually see patients, we talk to patients, we collect their case history. We also go to surgeries with our surgeons. But of course, because of COVID, right now we are trying to avoid so much contact with a lot of patients, okay? But don't worry, guys. So when I start having contacts with patients again, I will try my best to make another vlog, okay? Have a lovely day, and I'll see you in my next video.